This conference, which is being held in Kenya for the first time, gives us yet another opportunity to share knowledge, to learn from each other, to expand our networks, and to be able to also put our best foot forward as a country in terms of the interventions that we are undertaking. The conference comes at a critical time when global health focus is health for all. In Kenya, His Excellency President Uhuru Kenyatta has prioritized healthcare through his 4-point agenda, but I also want to recognize Her Excellency, the First Lady, our chief guest this morning, has equally prioritized our interaction and engagement with matters health, particularly focusing on women, children, and the infant among the vulnerable sectors of our society. Our target is that by year 2022, Kenya will be providing accessible, affordable, quality healthcare for all. And these aspirations cannot be attained without a well-motivated, highly skilled, well-developed, and fully engaged health workforce, whereby we do recognize nurses as a backbone of the health system in terms of delivery. Colleagues, the realization of UHC calls for reorientation of our health interventions with a focus towards preventive and promotive health, which we have learned yields a tenfold return on investment. And to this end, the role of public health nursing in primary health care cannot be overemphasized. Globalization, ladies and gentlemen, poverty, inequality, environmental degradation, and lack of social services can adversely impact morbidity, mortality, but also health outcomes. And it's for this reason that the world, including our own country, is facing new health challenges, including environmental pollution, natural disasters, a growing trend of chronic diseases. NCDs and injuries alone in Kenya have overtaken infectious and childhood diseases in terms of the burden, contributing upwards of 30% of all deaths registered in Kenya annually, as well as 52% of all hospital admissions today in Kenya. This is truly a challenging situation, which calls for public health interventions, thus also inviting cross-sectoral interventions. In reality, the major causes of chronic diseases are known, and if these risk factors were eliminated through public health interventions, at least 80% of all heart disease, stroke, type 2 diabetes would be prevented, and over 40% of cancer cases would also be prevented. Global health issues, colleagues, require global cooperation in response, require global planning, prevention, preparedness, and care that reflects health equity issues, among others. These issues require complex interprofessional and interagency cooperation and solutions that involve governments, that involve the nonprofits, and many times the private sector, all who are presented here today, as well as philanthropy. This global conference therefore creates another platform for practitioners in the public health nursing to share knowledge, experiences, and innovations towards promoting well-being across human lifespan. Ladies and gentlemen, Your Excellency, our First Lady, I wish to conclude by appreciating the role of nurses. It is also an opportune time for us to draw attention to thematic issues of concern for nursing, including the quality care, for which I look forward to hearing a bit more innovation in terms of what's happening in other countries. The global network of public health nurses will thus also be instrumental in enriching policy formulation, education standards, and international best practice for public health nurses across this country, but also globally. I look forward, therefore, for the network partnering with our training institutions as well as the regulatory bodies towards improving a quality of healthcare and well-being for all. On its part, the government remains committed to increasing the ratio of health workers to population countrywide, nurses as well as the other cadres, but also in terms of reducing the regional disparities in the distribution of health workers.